Are you searching for a career that's both rewarding and among the highest paid globally? Consider becoming a neurosurgeon. Neurosurgeons are medical doctors who specialize in diagnosing and surgically treating disorders of the brain, spine, and nervous system. Their work saves lives and transforms futures. But what does it take to become a neurosurgeon? Step 1. Earn a bachelor's degree. Step 2. Attend medical school. Step 3. Complete a neurosurgery residency. Step 4. Optional fellowships for specialization. Section 1. The promise and the purpose. More than just a salary. Neurosurgery is a field with a powerful reputation. It is often seen as the peak of medical practice. Many people hear about the high salaries. They see it as a path to financial success. And it is true, the compensation can be very high. But that is only a small part of the story. The real heart of neurosurgery is its profound purpose. It is a career built on helping people in their most vulnerable moments. Neurosurgeons are given a unique trust. They operate on the very core of a person's being. Brain, spinal cord, nerves that control everything we do. This is a field that offers more than just a job. It offers a mission. Imagine being the person who can remove a tumor from a child's brain. Imagine restoring a person's ability to walk after a spinal injury. These are the daily realities for a neurosurgeon. The work is incredibly demanding. It requires immense skill and dedication. But the impact you can have is almost limitless. You are not just fixing a part of the body. You are often restoring a person's life and their future. The journey to becoming a neurosurgeon is long and difficult. It is not a decision to be made lightly. It requires years of intense study and training. It demands personal sacrifice. However, for those who are driven by a desire to make a real difference, it is a path worth considering. The financial rewards are a byproduct of the incredible responsibility the job holds. The true payment comes from the lives you touch. It comes from the hope you can provide to patients and their families. This is the promise of neurosurgery: challenge and profound fulfillment. Section 2. The surgeon's craft. What a neurosurgeon actually does. What does a typical day look like for a neurosurgeon? The role is varied and dynamic. It is not just about spending hours in the operating room. A large part of the job involves detective work. A neurosurgeon meets with patients to understand their symptoms: chronic back pain, severe headaches, sudden weakness in a limb. The surgeon listens carefully. They ask detailed questions. This requires deep empathy and excellent communication skills. After meeting with a patient, the next step is often diagnosis. Neurosurgeons are experts at interpreting complex medical images: MRI scans, CT scans, X-rays. They look for abnormalities like tumors, blood clots, damage to the spine. This diagnostic process is critical. A precise diagnosis is the foundation for an effective treatment plan. The surgeon must be meticulous, with an incredible eye for detail. They work with radiologists, neurologists to confirm findings. When surgery is needed, the neurosurgeon's focus shifts. They meticulously plan the operation. Every step considered, every potential risk evaluated. In the operating room, they lead a large team: anesthesiologists, nurses, surgical technicians. The neurosurgeon must be a calm and confident leader. They perform delicate procedures on the brain and spine, using powerful microscopes and advanced surgical tools. Steady hands, intense concentration, and hours of focus, followed by meticulous post-operative care, recovery monitoring, and long-term support. The path to becoming a neurosurgeon is a marathon, not a sprint. It is a structured journey that requires patience and perseverance. The first step is earning a bachelor's degree. This typically takes 4 years. While you can major in anything, most aspiring doctors choose biology, chemistry, neuroscience. You must complete pre-medical course requirements. Your goal during these undergraduate years is to achieve excellent grades. You also need to prepare for the MCAT. Strong performance in both is essential to get into medical school. After your bachelor's, the next stage is medical school. This is another 4-year commitment. The first 2 years are primarily classroom-based. You learn foundations of medicine, anatomy, pharmacology. The last 2 years are clinical rotations, internal medicine, pediatrics, surgery. This is where you get your first real taste of patient care. During medical school, confirm your passion for surgery and specifically for neurosurgery. Find mentors and seek research opportunities to strengthen your application. Once you graduate with an MD or DO, you are officially a doctor. But training continues. Enter a neurosurgery residency program, typically 7 years. You train under experienced neurosurgeons, start with basic duties, then take on more responsibility. You will work long hours, learn complex surgeries, and manage critically ill patients. Some choose a fellowship after residency, 1 to 2 years. Examples include pediatric neurosurgery, spine surgery, cerebrovascular surgery. Adding it all up, the journey can take 15 years or more. Beyond the long years of training, what does it truly take to succeed as a neurosurgeon? A specific set of personal traits is essential. First and foremost, exceptional fine motor skills, hand-eye coordination. The work is incredibly delicate, operating on a grape inside a bottle. Steady hands, even under immense pressure. Resilience, high-stress situations, life and death outcomes. Remain calm, think clearly, make critical decisions in a crisis. Compensation varies by location and experience. In the United States, averages often range from $500,000 to over $850,000 per year. In the United Kingdom, a consultant neurosurgeon in the NHS might earn between $100,000 and $350,000 annually. In Australia, salaries typically fall between $300,000 and $600,000. In Germany, the range is often from $150,000 to $400,000. These figures are not starting salaries. They reflect experienced surgeons. The high pay acknowledges extensive training, immense responsibility, and challenge. However, this career demands significant sacrifices, grueling weeks, little time for family, constant stress. Hours can be unpredictable, day or night. Work-life balance is a major challenge. You must be a lifelong learner, staying up to date with research, technologies, and procedures. A daily commitment to excellence. After considering the long years, the intense pressure, the personal sacrifices, you might ask, why would anyone choose this path? The answer lies in the profound, unique rewards of neurosurgery. Deep intellectual satisfaction solving some of the most complex puzzles in the human body. Understanding the intricate pathways of the brain, of the spine, figuring out how to fix them. A challenge that engages your mind at the highest level. For those who love science and problem solving, every case is different. Every day brings a new challenge. The emotional reward is greater, restoring quality of life, giving speech back, helping someone walk again, removing a tumor. These moments define the profession, a platform for leadership and innovation, surgical robots, advanced imaging, new biomaterials, involvement in research, teaching the next generation, advancing medicine. Heal individuals and advance the field, a powerful motivator. Start today. Focus on your studies, science and math. Cultivate discipline and strong study habits. Seek opportunities to learn, volunteer, and connect with doctors and students. Ask questions. Stay curious. The path is long, but it begins with a single step. Take that first step on your journey. Your future patients are waiting for you.